I'm Thomas Baldrick at ASCO 2015, Oncology TV. Happy to have with us Dr. Eric Weiner from Rhode Island Hospital, here to talk about a phase 2 safety and efficacy EPAG study. Thank you, sir, for stopping by.
Oh, it's my pleasure.
So give us some background on this study.
Well, so we devised this study because patients that have solid tumors that get a drug called gemcitabine tend to have severe problems with having low platelet counts. And when they have these low platelet counts, they have a decreased ability to get their chemotherapy on cycle. Eltrombopag is a relatively novel oral thrombopoietin receptor agonist. And so what it does is it stimulates the bone marrow to make more platelets. It's been approved for aplastic anemia, it's been approved for ITP, but chemotherapy-induced thrombocytopenia is an unexplored area, and it's also a significant problem for patients. And so the impetus for this trial was to try to help those patients get their chemotherapy on cycle and ideally get better effects in the long term.
How did you go about doing this study? How many patients, et cetera?
So we took anyone that was getting a gemcitabine-based regimen. So it was either, we had two arms to this study. It was either getting gemcitabine and cisplatin or gemcitabine alone. And it was all comers of solid tumors. It wasn't selectively a pancreatic trial or a breast cancer trial. It was really anyone that was getting those regimens. And in the end, for the phase 2 trial, we've already published the phase 1 trial earlier this year, but for the phase 2 trial, we had 75 patients on. 52 of them received the chemotherapy with Eltrombopag, which is the study drug, and then another 23 were more as a control for safety issues.
What are the key findings you have?
Well, the key findings that we had was that for patients that received Eltrombopag, there was a much decreased level of thrombocytopenia in these patients, but more importantly, they were able to not have as many missed cycles or missed treatments. So patients for above all 1 through 6 chemotherapy treatments, about 29% of those patients had a had a delay of their dose in the Eltrombopag group, but between 57 and 67% of patients that didn't get Eltrombopag had a dose delay. So there's a significant difference between those two groups. The other thing that was rather interesting is that because Eltrombopag has a improvement in aplastic anemia, and therefore there's a stem cell signal, we also saw an increase in what we call trilineage hematopoiesis, which means that we saw decreases in the amount of anemia and decreases in the amount of neutropenia, saying that there really was an effect not just on the platelet line, but also on the other cell lines that come from the bone marrow.
So what follow-up work might you do?
Well, so the next portion would be to look at this in one particular disease entity. One of the difficulties with interpreting the data that we have is that there were a number of different diseases. There was breast cancer, there was bladder cancer, there was pancreatic cancer. It's very difficult to compare overall survival when you have different cancers throughout. And so I think the next step would be to create more of a phase 3 trial with one of those cancer groups so that we can better establish not just the benefits of the platelet count and the benefits of having decreased chemotherapy-induced thrombocytopenia, but more so to say, is there a progression-free survival and overall survival advantage by allowing these patients to get their chemotherapy on time?
Okay, Dr. Weiner, keep us posted, would you?
Yes, thank you very much.
Thank you for stopping by.
My pleasure.